Hi, I'm Katie, and what brought me to Dr. Chris is my daughter Jordan. We came to Dr. Chris when Jordan was about 4 months old. She was having multiple seizures throughout the day, about, I would say 8 to 10 a day, and they would last about 15 minutes at a time. And it was just terrifying and heartbreaking to watch. I was so helpless, and having been to Dr. Chris during my pregnancy, I knew that there was something that he could do to help her. And I'm really happy to say that as of today, she's pretty much seizure-free. She initially began medication for her seizures after we saw the neurologist about them, and since then her medication has not been increased, even though her weight has been increased. The neurologist has noted that he's really not all that concerned about them any longer, since we have not seen a lot of seizure activity, or really any seizure activity. When we came to see Dr. Chris at 4 months, Jordan was pretty much still acting like a newborn. We knew when I was 20 weeks pregnant that she was going to have some issues with hydrocephalus, and so we were expecting some delays and some issues. And since we've been here, not only have the seizures gotten better, just overall her development has progressed tremendously. As you can see, she's alert, she's awake, and you know, most people would say, well, isn't that what a typical 7-month-old does? But for Jordan, she wasn't doing any of that before we came here. She really hadn't progressed much. So to see the progression since we've been here has been an answer to prayer. She pretty much slept all the time. She would wake up to eat, or she would wake up when she got hungry, but really she would take her bottle and go right back to sleep. And when she would wake up, if we weren't in the room, if we weren't around, we wouldn't even really know she was awake because she didn't move much. And so you can see she's actually getting hungry right now. She's moving her mouth. She's looking around. She's moving that tongue. Hi, precious. Another thing that has gotten so much better since we've come here is that she's making eye contact. And as a first-time mom, I just couldn't wait for the day for my baby to look at me, to make prolonged eye contact. And so that is something I treasure. She also started smiling since we've been coming here. And while it doesn't happen very often, it just makes it that much more special when she does, because again, it's just so wonderful to see my daughter have emotions and interact with me and my husband. Her personality has definitely developed. We work with a speech therapist and occupational therapist, and they have just noted her personality as being spunky, and you know, she's called a diva because she knows what she wants and she lets you know what she wants. It was definitely an obvious change in Jordan after we began coming here. In fact, one of our doctors has noted just how amazed he is that her pituitary gland works as well as it does, considering the underdevelopment of her brain. And I knew when he said that it was all because of his work here on Jordan. And so for a doctor to acknowledge that, you know, he even is kind of questioning, how can this be? There's no doubt in my mind that it's because of quantum neurology and our visits here.